Welcome to the radiation treatment class. Hopefully this information will help you prepare for your radiation treatment and reduce your fears or stress about starting. While you're listening to the presentation, write down any questions that you have. You can take your questions to your next appointment and ask your healthcare provider to answer them. Your healthcare team is here to support you and answer any questions you have throughout your treatment. This class will take about 35 minutes to complete. You can pause anywhere along the way and continue by pressing play when you are ready. You will hear from two of us through the course of this class. I'm Jillian, a radiation therapist and clinical educator.
And I'm Krista, a nurse with CancerControl Alberta Patient and Family Education Team. This class is to help you prepare for treatment with external beam radiation. Patients and families tell us that they sometimes get too much information at once. This class will focus on information to help you get familiar with and start your treatment. We'll also talk about how you can get more information. Be assured that your care team will share more specific information with you and answer your questions throughout the course of your treatment. In this class, we will talk about the care team and the radiation department, radiation treatment, what it is and generally how appointments work, safety during radiation treatment, and possible side effects. As human beings, we don't remember everything we hear or see in a conversation or presentation. That's normal. To help you remember the things that are important for you in this class, please feel free to take notes. You can pause this presentation while you find a pen and paper if you need to. In addition to this digital class, there are a few different resources you can check for information about radiation treatment. Here are some of the resources you may be interested in. The Radiation Treatment Book is a very useful resource. You can take it with you to appointments and make notes in it to help you remember important information. If you don't already have a copy, download it from CancerControl Alberta's website or ask for a printed copy the next time you're at the Cancer Centre. Read the book all at once or read sections as you need them. You'll find the book refers to other print resources as well. Ask for the ones you want or find them online. You can also find videos about radiation treatment on the CancerControl Alberta website. Each of the videos has a title and short description to help you decide which ones you want to watch. Check out the videos or the book on the same page where you found this class. Share these resources with family or friends who want to know more about what you're going through. And of course, your cancer care team is an invaluable source of information. They will provide you with further information as you go, and you can always ask them any questions you have or talk with them about concerns that come up. Let's talk more about the cancer care team. While you're going through radiation treatment, there's a large group of people making up the care team. You are a key member of that team. Also there to treat and support you are a number of people in the radiation team. As well, there are a number of supportive care staff who are available if you need extra help. Everyone plays an important role. The radiation team is made up of a group of people with different expertise. They work together to provide quality treatment in the radiation department. Some of these people you will see regularly, and some you may never see. Having a sense of the team may help you feel a bit more comfortable when you are in our departments. The clerks are often the first people you will see when you enter the department. The clerks schedule appointments and will call or send you a letter about upcoming appointments. They also check you in when you arrive. If you don't check in with the clerk, the radiation therapist won't know you are in the department. Your radiation oncologist reviews all of your medical information and works with you and the team to make the best treatment plan for your situation. The radiation oncologist will monitor your treatment and how you're doing. They help answer your questions and help you manage any side effects if you have them. Your radiation therapist will see you each day. They give you your CT scan to help plan your treatment. They work with the oncologist and medical physicist to create your treatment plan from the doctor's order and deliver your radiation treatment. Your radiation therapist will talk with you about what is coming next, answer your questions, and help you with any side effects you have. The team also includes nurses. You will generally see them when you see the radiation oncologist. The nurses will help answer your questions and, if needed, help you manage your side effects. We also have medical physicists and equipment engineers on the team. You likely won't see them, but they're working to support radiation treatment planning and ensure our equipment is always performing as it needs to. Our equipment is tested regularly to ensure every treatment plan is precise. In addition to the radiation treatment specialists, the supportive care staff is available to help you if you need. Across our cancer care sites, we have dietitians who can help you figure out how to eat well if you're not as interested in food as you have been. Food provides the body with nutrients, vitamins, and energy to manage through treatment, and so maintaining a healthy diet is part of doing your best throughout treatment. We also have social workers, spiritual care providers, and psychologists that you can access if you're struggling with your feelings, relationships, or with financial issues. They're sometimes referred to as the psychosocial team. Physiotherapists, occupational therapists, and speech pathologists are also part of the supportive care team. They are sometimes referred to as rehabilitation specialists. They can help you manage changes in your physical body that are a result of cancer or cancer treatment. For example, some of our patients have had surgery and may need help from a physiotherapist to get that area of their body moving to its full range of motion. If you think you might need support from one of these care providers, talk to your radiation therapist, nurse, or oncologist so we can help connect you. When it comes to your cancer care team, you are a key member. You play a very important role in ensuring the team can provide the best care possible. Please let your care providers know how you're doing at each appointment. Please also ask any questions you have and let us know if you are or think you might be starting to experience a side effect of treatment. Hearing how you're doing and what questions or concerns you have helps us to provide the best care possible. If we know what matters to you with each visit, we can help provide the support, information, or even referrals you need. You also take a number of actions like getting to and from appointments, looking at information, and taking steps to manage side effects if you need to. Now that you have a sense of the team, let's briefly talk about the radiation department. There are a number of cancer centers that can provide radiation treatment around the province. In each of these centers, the radiation department is on the lower or basement level. This is because the large equipment and extra thick walls are very heavy. Ask any staff member how to find the radiation department if you aren't sure how to get there. The radiation department will have a main reception desk. Always check in there when you arrive. The clerk at the reception desk will direct you to where your radiation therapist is going to meet you.
Before you start your radiation treatment, you will have a CT simulation appointment. Often people call it the CT sim appointment. The CT sim appointment is not a treatment appointment. No radiation treatment is delivered during this visit. This appointment is used to get detailed information about the location, shape, and size of the cancer. This information is gathered using a CT scan. CT stands for computed tomography and is the type of technology used to get the pictures we need. This detailed information is used to create your personal radiation treatment plan. Your first appointment will be scheduled for when the treatment plan is ready. During this appointment, you may also be given one or more permanent tattoos. You can see in this picture that these tattoos are very small, about the size of a freckle. Tattoos help us get you into the same position every time you come for treatment. Your radiation oncologist may ask that you have a shell made. A shell is another way that we can help people get into and hold the right treatment position every time. The shell can also be called a mask or a mold. Not everyone needs a shell, but if you do, we create this support specifically for you. The shell is made to fit you snugly and helps hold the part of your body that is being treated in the proper position. The shells are made of an open mesh so you can breathe and see through it. The shell is made before your CT simulation imaging is done. The radiation therapist will explain the mold-making process if you need one. If you feel worried about wearing one, they can also offer you ideas for relaxation during the making of the shell. Ask them for help if you are nervous. After your CT sim appointment, there is a lot of work going on behind the scenes to design your plan. Your radiation oncologist works closely with the radiation therapists and medical physicists to ensure that the radiation treatment is targeting your cancer while avoiding as much normal tissue as possible. These images are from a patient with prostate cancer taken during a CT sim appointment. The radiation oncologist uses these images to draw where treatment will be given. They often also outline healthy tissue near to the tumor to help guide treatment planning. Your radiation oncologist prescribes a dose of radiation and the type of treatment. At the end of the treatment planning process, we have created the best plan for your specific situation. This picture represents a treatment plan for a patient with breast cancer. The treatment planning takes into account the size and shape of the patient, as well as the location of the cancer and of healthy tissues like your lung. Your completed treatment planning information is sent to the treatment unit, where it is stored electronically, ready for you when you arrive for treatment. Now let's talk about the actual treatment. Radiation treatment is the use of high-energy X-rays to treat very specific or local areas of your body. There are different ways to get radiation treatment. Most people get external beam radiation. This means the high-energy X-rays are delivered from outside your body to the area requiring treatment. External beam radiation is done using a LINAC machine like the one in this picture. External beam radiation is the focus of the rest of this class. A small number of people get different forms of radiation. If you are interested, you can find out more about these different forms of radiation on page 5 and 6 of your radiation treatment book. Earlier, we talked about the radiation treatment plan. Your radiation oncologist will prescribe a dose of radiation for you. In almost all cases, this dose is given over a number of days. The number of days required for treatment is part of your plan. Your team will talk to you about how many days of treatment you will get to make up your whole dose of radiation. Treatment is given weekdays with a break over the weekend. Generally, treatment is not given on statutory holidays. So for example, a 16-day treatment schedule would look like this. If there were a stat holiday during your treatment, your schedule would be adjusted by adding a treatment day to the end. The radiation department will schedule your treatments for you and talk with you about them when you start. For people who have had surgery or have had one or more teeth removed, radiation treatment will start after the body has had time to heal enough to manage the radiation. Each day you come in for a radiation treatment will follow a similar pattern. The first treatment day will be a bit longer, but after that time in the treatment room, it will only take about 15 or 30 minutes, although some take a bit longer. The treatment itself is only a small part of that appointment time, just a matter of minutes. The additional time in the room is spent bringing you in and getting you ready into position for treatment, confirming your treatment position with an X-ray or CT image before starting treatment. The image is done using the same LINAC machine. After treatment, we will lower the bed so you can get up. None of this can happen if we don't know where you are. So just a reminder, please check in with the clerk when you arrive in the department. You've heard about the process. Now let's watch a bit of one of our videos and see what the treatment process can look like. The video clip you are about to watch is from the videos we have on CancerControl Alberta's website. You can access the full video or any of the series from the same place you opened this class. Now let's hear from one of our radiation therapists in Red Deer.
On the first day of treatment, the patient will arrive. They will check in at the front desk. The front desk will notify the staff that the patient is here. The radiation therapist staff will go out and introduce themselves to that patient and bring the patient over to where the treatment unit is. So we bring the patient into the treatment room. We show them the linear accelerator, which is the machine that will be delivering the radiation to the patient. We set that patient up on the bed in the same position that they were set up for when they came for that CT simulation. And then we raise the bed up underneath the machine, and we will manipulate the patient's body in order to line them up with the tattoos that they had previously in the CT simulation. So once we're happy with the patient's positioning, we will let them know that we are leaving the room and just to hold still. Now the radiation therapy staff, as much as they would like to be in the room with the patient during the treatment, we can't. So we have to stay outside. The machine rotates around them, but they will not be touched by the machine. When the radiation starts, they cannot see it, smell it, taste it, nothing. They may hear a bit of a buzz in the background, and they also hear a little bit of a clunk, and that will acknowledge that the machine has started.
When you're lying on the bed, the machine does move around you. And so the radiation can be delivered from one position, or it may be delivered as the machine moves around you, or you may find that the machine moves to a different position, delivers some radiation, moves to another position, delivers some radiation, and like that. So it's different for different people. Despite you being left alone in the room, you are being monitored from the outside. Your therapist can hear you from the outside of the room, and they can see you from the outside of the room. And they will give you instructions so that if you are uncomfortable or afraid, you can always signal them either by voice or, as they indicate to you, so that they can stop the treatment, come in, check what's bothering you. They can make sure things are good.
So once the treatment has completed, the radiation staff will come into the room, bring the patient back down to the ground, and give them a little bit further education on how to take care of themselves during the process of radiation.
You may have noticed these lines of light in the video. These are lasers of light used to help get you aligned properly for treatment. They are not radiation. Let's explore a couple of other questions that we often get asked about radiation treatment. Does radiation hurt? Some people worry that it does hurt. The answer is no, radiation treatment does not. You cannot feel, see, or smell the treatment. You will hear the treatment machine buzz, but it will not hurt. Will you be radioactive after treatment? The answer is no. You will not be radioactive after your external beam radiation treatment. You will not take home radiation, and you do not need to worry about exposing your family, pets, or friends to radiation. Can you drive after treatment? Unless your doctor tells you that you shouldn't be driving, you can drive. Each of your radiation treatments will be given by a team of radiation therapists. At each appointment, you can ask them questions and let them know how you are doing. The therapist will not be in the room during your actual treatment, but they will bring you in, ensure you are in the correct position, monitor, and administer your treatment, and be there when it is time for you to get up and leave the room. Now let's talk a bit about safety. Throughout radiation treatment, we want patients to feel safe, be safe, and act safely. In addition to all the planning and monitoring we do around the equipment and your treatment plan, there are other things that help protect your safety. Every time you come in, we will ask you for your last name, birthday, or other personal identifying information. We do this before each treatment to ensure that you get the personal treatment prescribed for you. When it comes to protecting people from unnecessary exposure to radiation while the treatment is being delivered, we have a few different things in place. Physically, the rooms are built of very thick concrete and lead walls to prevent radiation from leaving the room. In addition, the entrance to the rooms have corners and turns and sometimes doors so that the radiation cannot leave the room. When entering a treatment room, a person should wait for permission so they don't accidentally enter while a treatment is in progress. This protects against accidental exposure to a radiation treatment and protects each patient's privacy. When radiation is being delivered, you will be in the treatment room alone. This protects the radiation therapist or your family members from being exposed to the treatment, but you will still be monitored closely. The radiation therapists can see and hear you even when they are not in the room. There are cameras and an intercom system in the room. If you need help, you can call out or wave your hand. While you are in treatment, you will be raised up in the air on the treatment bed. The bed won't be this high when you enter the room. It will be in a lower position so you are able to sit on the bed and then move into a lying position. If you feel unsteady on the table or want extra support before the table is raised, we have straps or other supports that we can use to help you feel safer. When treatment is over, we ask that you don't move until we have lowered the bed and it is close enough to the floor for you to reach with your feet when you sit up. During treatment, you will need to lie very still. This allows the radiation treatment to be delivered to the right place. People with cancer and those on cancer treatment can have weakened immune systems. This means their body is not able to fight off infections like normal. There are some simple things you can do to help protect yourself and others who are also attending appointments at the Cancer Center. To protect yourself and others, it is very important to practice good hand hygiene. This means using hand sanitizer when you enter and leave the Cancer Center. Hand sanitizer is available throughout the Cancer Center. Washing your hands with soap and water is important before and after eating, before and after going to the washroom, and whenever your hands are visibly dirty. Another way to protect yourself and others is to take precautions if you could be sick with an infectious illness. Please call before you come to the Cancer Center if you have a new cough, or for those who have had a long-term cough, the cough changes, if you have a fever, a sore throat, or a rash. These symptoms can be caused by an infection. We also ask you to call if you know you have been in the same place with someone who has an infectious disease. When you call, we will figure out how best to proceed to keep you and others safe. We recognize that family and friends are very important supports when you are going through treatment. However, if your family or support member is sick, they cannot come into the Cancer Center.
We just have one more topic to go: possible side effects. Side effects from treatment are possible, but many people experience no side effects at all. I'm going to talk a little bit about side effects now. Your team will talk with you about the side effects you should be watching for and will help you if you have any questions or start to experience side effects. Side effects are a result of radiation treatment damaging healthy cells and then those cells healing. Most side effects take about 2 to 3 weeks or longer to develop, if they're going to develop at all. If side effects show up, they can continue until about 2 weeks after treatment is finished before they begin to get better. Some people who are getting radiation treatment are also getting systemic treatment at the same time. For these people, side effects may be a little bit more intense or they may start a little sooner. If you're in this situation, discuss this with your care team. Possible side effects of radiation treatment can be grouped into 2 groups: general side effects and site-specific side effects. We'll look at general side effects and explore some examples first. Then we'll talk about site-specific side effects. General side effects could be experienced by anyone who is getting radiation treatment, no matter what area of their body is being treated. When we talk about general side effects, we're talking about fatigue, skin irritation, sexuality and intimacy changes, and sleep pattern changes. Pages 15 and 16 in your book provide an overview of side effects. The pages look just like this. The general side effects are listed in page 15 in this area. More information can be found by turning to the page number provided for each of the possible general side effects. Let's look at some examples. Radiation treatment has to pass through the skin to get to the treatment area. The skin may react to that radiation and become irritated. Side effects can be mild, not too bad, moderate, or severe, much worse. In the case of skin irritation, the signs and symptoms can vary depending on how intense the side effect is. So, mild irritation means your skin might look slightly pink in color, might feel warm, or be itchy. In a moderate case of skin irritation, you might see a dark pink color, dry and flaky skin, and itchiness. The most severe skin reactions will look red, have blistering, and clear liquid coming from the skin. Severe skin reactions are rare, and we want to make sure we notice skin reactions early so they don't progress. Talk to your radiation therapist, nurse, or oncologist if you notice any of these changes to your skin. They will help you make a plan. Read about skin irritation on page 19 in your radiation treatment book. You can do things to help prevent side effects from happening, or, when they do happen, to help manage them. We won't spend a lot of time on this here, but you can find information in your radiation treatment book. Let's explore two of the general side effects, skin irritation and fatigue, so you have a sense of what kind of information is available. There are a number of things you can do about skin irritation. They are all listed in the radiation treatment book for you to check any time. Some of the things you can do to prevent skin irritation or help your skin if it starts to get irritated include washing your skin gently, using warm, not hot water, asking what cream to use. Some creams have scents or chemicals that can irritate your skin, letting air at your skin, covering your skin in the sun, wind, or cold. Toward the bottom of this list, we recommend you avoid sunscreen in the area being treated. The ingredients in sunscreen can irritate skin if it's growing sensitive. We recommend you cover up the area with loose clothing instead. Another general side effect is fatigue. There are a number of tips on how you might manage fatigue on page 17 in your radiation treatment book. Some of the things you can do to help manage fatigue or low energy include trying to exercise or move your body, getting good nutrition, managing time around your energy levels, taking naps, reducing stress in ways that work for you, and accepting help. You'll notice a little video icon on the screen. When you see this video icon in the book, it means there's a video you can watch to learn more. The web address will be listed along with this image. Now let's talk about the second group of side effects, site-specific side effects, where general side effects are things that anyone might experience, no matter where they're being treated. Site-specific side effects are specific to the area of the body being treated. Page 15 and 16 of the radiation treatment book also gives an overview of the site-specific side effects. Site-specific side effects are different depending on the area of the body being treated. Start by looking for the area of the body where you are getting treated. For example, this might be the brain or head, the mouth, or getting treatment to the stomach. There are many areas listed on these pages. Once you find the section for the area of the body where you are being treated, you will see a list of possible side effects. Some have further information in the book, and the page number is provided. You will discuss the area of the body where you will be getting treatment, potential side effects, and any concerns or questions you have with your care team. People have often heard about side effects as part of cancer treatment. These are some of the more common questions we get about radiation treatment and side effects. Does everyone get side effects? No, not everyone will get side effects. Some people go through treatment without developing any side effects at all. And of those who do develop side effects, they can, as we discussed, be mild. Will I lose my hair from radiation? Not necessarily. With radiation treatment, people only lose hair that is in the treatment area. So here are a few examples. If you are being treated in the area of your head, you may lose that hair. If you are treated in the area of your mouth or neck, you may lose your beard or mustache. If your treatment is to an arm or leg, you may lose the hair on that arm or leg. The hair may or may not grow back. If it does, it will start to grow back about 3 to 6 months after radiation treatment is complete. Can I get side effects after treatment is done? Yes, side effects can develop after treatment. As mentioned earlier, it takes many side effects about 2 to 3 weeks or more to show up. If your treatment is only days or weeks long, the side effects won't show up until the end of treatment if they are going to occur at all. For longer treatments, side effects can still show up to 2 to 3 weeks after treatment has ended. What can I do about side effects? Not everyone will get side effects, but either way, there are things you can do. Start by finding out what side effects you should watch for. Read over the common side effects and the side effects based on the area of your body where you are getting your radiation treatment. Sometimes there are things you can do to prevent side effects, like paying extra attention to your mouth care if you are receiving radiation treatment to that area of your body. Knowing about the possible side effects also means you may notice them early if they do occur. If you start to experience side effects, talk with your healthcare team about them. They will talk with you about ways to manage the side effects. Sometimes that means a referral to another member of the care team, but often it means doing specific things yourself to help keep the side effects from progressing. There are a number of things people can do about side effects described in your radiation treatment book. You don't have to know what to do about side effects right now. Some people will want to read that information right away just in case they need it, and others won't. The information is available to you when you are ready or need it. Start now by getting to know what side effects to watch for and any preventive actions you might take, those things that you can do to protect against side effects.
We hope this helps you to have a better sense of radiation treatment. You will learn more as you go. If you have specific questions or want more information about your treatment, there are people and resources available. The book is a great resource for you to look at and take with you to appointments. Go back to the book to find information as you need it. In addition to the information in this book, there may also be other print materials or videos that might help. Throughout the course of your treatment, please don't hesitate to ask us your questions. We are here to help. Thank you for listening to this class. This has been a general introduction to radiation treatment. Your cancer care team will understand your cancer and treatments best. Talk with them about any questions or concerns you have.